It's that time every morning as we talk with one of our professionals from Maui Health. Here on the phone line, CEO of Maui Health, Mr. Mike Rembis. Good morning, Mike.
Good morning.
Hey, I just want to say mahalo nui for making the Monday trip again. I think you're going to be the Monday guy from now on.
Happy to be it.
Happy to be it. All right, Mike, we have a couple of questions here from our listeners, and we're going to get right into it. Let's see. First question comes from Josie, Mike. She says, I've noticed a lot of people shopping in groups or families. Shouldn't we be sending just one representative from each family to the shopping? Also, should younger people be shopping for older people, or does it not matter who shops for the family?
Well, we would highly recommend that try to have one person shop for the family. I mean, it's not required, but I think the more we stay home and shelter in place, the better it is for all of us, and the less contact we have. Social distancing is so important that if you can, I think it's better to have one person shop for the family. And younger people, if you don't mind shopping for your kapuna, please do.
Yeah.
Older people have a slightly higher risk, and for them to be able to stay home and not go into a shopping center, it's a good thing. I would also suggest that if an older person is going to shop, look at many of the stores. A lot of the markets have special hours just for seniors and people at high risk. And that usually means there's less people in the store. It's not as crowded. And you don't have younger people that potentially could be carrying the disease. So I would highly suggest either have a young person shop for you or try to take advantage of those senior hours. It's perfect.
And should we keep our young children at home, right?
Well, preferably.
Yeah.
I mean, the more we stay at home, I think the better for all of us.
Exactly. Well, Mike, I have here some statistics of the total cases and stuff. Do you have that in front of you right now?
Yes, I do.
Mike, can you run through that stats for us, please?
Well, as of Friday, we had 36 positive cases on Maui. Interesting about that number, though, there's about 11 of those cases that are no longer infectious. They're healthy, they're doing fine, they've gone through their quarantine, and I think we're going to see more and more people drop off of the number that are being quarantined in their homes. That's just going to continue. We've had one hospitalization on Friday. Actually, we had up to 3, and that's going to happen occasionally. Many of these people are hospitalized for other conditions as well as having COVID-19. So just because someone's hospitalized as a COVID-19 doesn't mean that's the only reason they're hospitalized.
Good. Okay, which brings us to this next question. This comes from Mark from Kihei. If over half the Maui cases have recovered by more than half, why do the numbers remain the same? And shouldn't they be also reduced by half? Meaning, we actually have 12 cases, not 26.
Well, I think the way the Department of Health is looking at it, they're trying to identify how many people have contracted COVID-19 and are positive on the island. That number is very important for them to track so they understand how widely spread the disease is. So this is being kept for really understanding the surveillance in the community and the prevalence of the disease. It does not necessarily mean that's the number of people quarantining in their homes at this time. But it's an important statistic for the Department of Health to project where this virus is going and how significant the spread is.
That's true. And my final question to you would be, we have a lot of actually other questions that come in via text and some through email, and some are very, very concerned of the gathering at the beaches. Do you have any suggestions or advice on that, Mike?
Gathering at the beaches, if you're not maintaining your social distance, you're defeating what we're trying to achieve as a community. It's so important. If you're going to go to the beach, go surfing, go paddleboarding, swim, but don't congregate.
Yeah.
Large groups congregating, not maintaining social distance is really going to defeat what we're all trying to accomplish, which is to reduce the spread of this disease as quickly as possible and making sure that whatever surge we have is as small as possible. Mm-hmm. So, I've walked to the beach myself. Yeah. Walking to the beach and running on the beach is fine. Don't stay on the beach. Don't socialize in groups. it's important for all of us on Maui.
Yes, I believe so too. And, with all of the helpful information we get from you guys there at Maui Health, I personally believe this opportunity is for us to seize and to show everybody that we are no ka'oi, or like the mayor say, Maui strong. Wouldn't you agree there, Mike?
The mayor's right on. The mayor's doing all the right things for us, and I applaud him. We need to have social distancing, and I applaud Pacific Media Group and KPOA for making this show available to the community. Hopefully we're answering questions and helping.
Yes, you guys are definitely doing that. And as we all say, we're in this together, and we'll do this again throughout the week. So I want to thank you, Mike, for your time this morning, and we'll talk again.
Look forward to it.
Aloha,
Be
Mike.
safe.
Yes, sir.
Take care.
Bye-bye.
Bye-bye.